precedent and a faith in the possibility of something better. It irritates me to be told how things have always been done. I defy the tyranny of precedent. I go for anything new that might improve the past. This is a quote from Clara Barton, a well-known nurse and founder of the Red Cross. And it really illustrates the course that nursing has taken through history. Most of you have or will receive care from a nurse such as myself sometime during your life. And you have faith that the person taking care of you has received an education and has the latest of medical technology at his or her fingertips. But without innovators like Clara Barton, nursing never would have advanced to the profession that it is today. So today I'd just like to take a very brief look at how nursing has evolved from giving basic patient care to affecting patient outcomes and making critical decisions in their care. To begin, we'll look at the start of nursing in the 19th century. The very first professional nurses received as little as 3 months of training, with primary duties including bathing, feeding, and housekeeping. Perhaps the most famous nurse, Florence Nightingale, graduated from one of the first schools of nursing in Germany during the 1850s. Her innovations in the field of nursing are credited with drastically lowering the mortality rate during the Crimean War, during which over 2,000 British soldiers died from wounds, but over 16,000 died from disease. As described by her American contemporary, Louisa May Alcott, during her time as a Civil War nurse, duties included bathing, feeding, administration of medications, dressing wounds, and cleaning, etc. But again, they were looking forward to see if they could do something more. And as described by Florence Nightingale in her book, Notes on Nursing, nursing, has been limited to signify little more than the administration of medicines and the application of poultices. It ought to signify the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection and administration of diet, all at the least expense of vital power to the patient. Now that we've examined the role of the nurse in the latter half of the 19th century, we'll take a look at some of the major changes that happened during the 20th century, particularly in America. While little had changed in the role of nursing at the beginning of the 20th century, by the end, the 1990s, nursing had really become a respected profession. So from 1900 to the 1940s, nursing duties remained much the same as they always had. Duties included housekeeping and personal care in hospitals and private homes, sterilizing instruments and catheters, and administrating medications and leeches as ordered. With the start of the Second World War, the role of nurses changed drastically. From the 1940s to the 1960s, nurses received specialized care in areas such as anesthesia and psychiatric care. And according to an article from Nurseweek, for the first time nurses were really at the patient's bedside, making their own choices based on their own judgment and dealing with the consequences. So again, they're moving from the routine, hands-on, basic care to actually managing patient care. Unfortunately, not all aspects of nursing advanced quite so rapidly. I read an article where one nursing graduate in the 1950s remembers preparing an injection by crushing pills in a mortar, heating that mix over a open flame in a teaspoon, and then drawing it up in a glass syringe. And needles were still being sharpened and reused. The period between the 1960s and the 1990s saw a massive growth in technology and education, particularly in regards to nursing. The nursing practitioner movement really had a lasting impact on transforming the traditional role of a nurse as a physician's assistant to an independent practitioner. Nurses saw a rapid increase in technical skills and medical knowledge, and by the end of the century, the nursing profession had exploded into a really vast number of specialties, including critical care, public health, pediatric specializations, and many more. The rapid growth of nursing in the 20th century has continued into the 21st century. Today, nurses fill so many roles it would take another speech to describe them all. Today, education ranges from a 3-year associate's degree to a doctorate of nursing practice, in which they really do practice like physicians. Today, a licensed nurse uses a scientific process, known as the nursing process, to make independent assessments, nursing diagnoses, planning, interventions, and evaluation of patients. Nurses monitor, plan, and give patient care using advanced technology, information management, and enhanced communication with other healthcare providers. What does the future hold for nursing? According to the Institute of Medicine, competencies must move from task-based proficiencies to higher-level competencies that provide a foundation for care management, knowledge, and decision-making skills under a variety of clinical situations and care settings. So again, we're just moving from that basic hands-on care. Not that that will ever go away. There's always going to be people who need to do that, but doctors can only do so much. So nurses have really been called to step up and try to fulfill some of those tasks that doctors just can't anymore. So it's clear that the nursing profession will continue to evolve as a future. So as a beneficiary of the many advancements in medicine and nursing, I hope you've caught a glimpse of the important role that nurses play in healthcare today. So the next time you visit your doctor's office, please take a moment to appreciate what nurses contribute to your healthcare.